In the last 30 years or so, there's been a steady increase in the incidence or the occurrence of tooth decay, we call dental caries. And dental caries is linked to consumption of sugar, refined sugar. And typically over the years, it's been seen that when economies do well and people have more access to sugar, then the incidence of dental decay goes up. And that is what we are seeing now. My own generation that grew up in the days of deprivation, we did not have too much exposure to sugar, plain sugar, but also the hidden sugars we find in things like candy, confectionaries, soft drinks. But that generation does not have as many problems. And when we check that group of people, you find they don't have too many problems with tooth decay. But with the younger generation now, you find children as young as 2, 3 are already losing teeth. So that is a big problem. It's a big problem. It's the biggest problem. There are other things that would cause concern, like gum disease, cancer at a smaller scale. But the biggest problem, by large, the biggest problem is tooth decay. There's certain bacteria in the mouth that grow in number, and they produce substances that irritate the gums. And so the gums become swollen, they begin bleeding. Bleeding gums are a sign that something's wrong. When you're healthy, your gums should not bleed when the gums are healthy. And if they're being looked after properly, they should not bleed when you're brushing. So all those are signs that the body is complaining about something. So gum disease is another one. Now, gum disease, typically, what you'll find in the older generation, like the generation, say, of my fathers, they will not have decay. But because of not consistently looking after their teeth well, the gum gets inflamed, and it begins to, it swells, and then it begins to detach from the tooth. And this membrane I talked about in the beginning gets affected. So over time, the gum keeps going down, down, and then you have teeth that are moving, like blowing in the wind, in the worst case scenario. Eventually, some of the teeth just fall out, almost painlessly, but it's been happening over decades. Gum disease is typically, occasionally you have an acute episode where it's very painful, but it tends to be more chronic, low grade. So ignore it. It doesn't cause too much bother. You just keep ignoring it year after year and after year, and slowly the tooth is losing support. The commonest cause of bad breath is not brushing one's tongue. Now, having said that, if you have a cavity, food is collecting there, especially if it's a large cavity, food begins to decompose, and so that will cause bad breath. So if there are cavities, several cavities, that can also cause bad breath. If the gums are infected, that can also cause bad breath. And going further back, if there are tonsils, people get regular tonsillitis, infections in the nose, in the adenoids, usually one would know that is happening. Going further down, if you have a chest infection, some people, by that time you're fairly sick, So all these things can cause bad breath, potential causes of bad breath. But if one takes care of brushing their teeth properly and flossing, most of the time, the problem of bad breath is taken care of.